Hi Sarah, it's Professor Melanie giving feedback on your data analytics evaluation number 2. So again, just thinking of overall APA formatting and overall paper-wise, you would have your running head here, which is not in, I don't think, the student APA book, but it might be in the professional APA book. So it's always good to try and practice just putting in a running head. And then your title, I minimized the font to be the same font size as everything else and unbolded it. That's you just want to make sure that you have the same font size. And then you have page numbers, so thank you. And then this would be more in the middle of the page, this here. So you could either find a way to center it in the page with your formatting, or you could just hit enter a few times and kind of center this title a little more. But again, no points. I'd like to give everybody really detailed feedback because I want you to be stellar at understanding APA and paper writing and things like that when we're done with this program. I want you to be able to help some be part of a chapter in a book or something like that. So it just, I give a lot of feedback. So please don't take it as any other way other than helpful. So in this particular evaluation, number 2, we're looking at the target or goal, and we want to make sure the clinical problem is clearly identified and directly related to information systems or technology, and that the significance of the problem is identified, and that our goal is clear, our targeted outcome is clearly identified. So as you stated here, surgical site infections are extremely important in healthcare, and then having a goal of zero surgical site infections is extremely important. So what I would do is I would back this up with some reference. Joint Commission, they look for zero harm, CMS, AHRQ, anything like that, just to back up what you're saying, because you want somebody when you're writing to say, oh, this is a problem. Oh, all of these references kind of support that. So I would add a little bit of references to this section and say, here's who agrees with my statement. These people, this author, this agency, Joint Commission, and just make that really a solid argument. And then they cost hospitals in billions of dollars a year. Do you have a citation for that? Is it $50 billion, or is it immeasurable? So something like that you can kind of, or even how do we know they're preventable? So again, just kind of backing up a little bit of what you have. I think that's really important to make your stand of your point. And then I think that you did a great job drawing in, giving an example of in a tertiary care hospital, here's what happened. So I don't think you would need to make this a new paragraph because it's still the same topic and the same thing. So you have a lot of teeny paragraphs. Just be careful of that. They, if it's the same information, you don't have to do that. And then for your in-text citations, the period comes after the AL. So it would be Luau, I don't know how you say that name, et al. Period, comma, 2010. So that's how you would cite that one. And then again down here, ATAL. And then this is great. So the estimated for the saving for this facility. So if you, and then you want to make sure that the citation goes within the period, unless it's a citation of 40 words or more, then you have to indent it. So just giving you feedback on APA. So then this here, your study that you talk about, maybe you could tie that together with what your goal would be overall. You did a great job adding some more information on another study. They don't attend post-op appointments as scheduled. How can you use technology, knowing what you know from these studies, to help decrease or reduce surgical site infections? That's your goal, is to reduce them. So how much do you want to reduce them? What's your target goal? And do you want to decrease the infection rate, and ultimately you will have a decrease in cost of care. So just thinking about that when you come up with your target goals clearly identified. how would you want to do that? So you're here, great goal to reduce surgical site infections by at least 50% within 2 years. So that is it's an achievable goal that's measurable. So is there anything, maybe even an interim goal you would want to say, like maybe over the first year you would want to reduce it by maybe 5% within the first 3 months. I'm just making that up. So I think that would be, a good goal. And then the only thing that I would state as a healthcare quality person is that 2 years is a long time to reduce those infections. Maybe within a year you could reduce so much, because we want to impact patients, as soon as possible. I'm going to fix this reference up here for you. And maybe that's the overall goal, but maybe you could have an interim just so that people would see that it's really important that we work on it and we start to see results. So again, nothing here is wrong, but I think that you could tweak your, what we're going to do with these papers is kind of connect all of these together, the problem, the goal, the data, and the results all into one larger presentation or paper. So you can tweak all of these mini papers that you have going forward with feedback that you're getting from these videos that I'm doing. So again, I think that surgical site infections should totally be something that we have to have a way to reduce those. And then how are we using technology to do that? Is it that we're having a beep on the patient's wristband when we scan them for surgery that says, did you start your antibiotic? That type of thing. So what are we doing technologically wise or information systems that is helping to reduce these surgical site infections? And can you add that into your papers and your project and your data analytics evaluation? So I think the one thing, if you look at surgical site infections, is sometimes they don't make the cut before the antibiotic is past the time, so they need to rerun that. So how can we make sure that when we give that antibiotic, we do start cutting on those patients? Is there a way electronically or technologically that we can say, hey, you've got 5 minutes to start. If not, you need to rerun this antibiotic on this patient to reduce those infections. So hopefully you can take this and improve these papers that were, the first two, by the time we get to the final paper, and just kind of tweak everything as you go along. And the other thing that I would just add, and this is, again, a lot of times you can use APA headers. If you look at the Purdue OWL, or if you look in your APA book, there are headers. So you could have, an abstract, and page, and then the next page would be your intro, and then you start to say the problem. And the problem maybe is a large header. I'm going to see if I can get this in here without messing up your paper too much. Hold on. Let's center this. So this is obviously the target or goal. Maybe if I could type. So this would be centered within your paper. It would be bolded because it's a primary level header. So infection target, rate, or whatever you want it to be, something like that. And then when you do your first paper, you would have surgical site, the problem, surgical site infection. So the headers in APA papers really help you kind of break up what you're going to talk about in your paper so that people know. So if I read your abstract, I read your intro, then I would say well, what's coming next? And it would be, I'm going to just make this up here. So it would be and then it would be, your regular unbolded, uncentered, surgical site infections, blah, blah, blah. And then you can kind of talk about what the problem is. And then you can talk about, your target. And then the next one that we're going to do, our number 3, is the data. So maybe your next header, when you do your paper, the next one would be centered, and we're going to bold this, and it would be current state of surgical site infections, infection rate. I'm going to make this up at Acme Hospital. I don't even know if that's a name, but so you could create something like that, and you could totally make up the next part of your data saying our baseline surgical site infection rate is, I'm going to totally exaggerate, 90% of patients have a surgical site infection, which would be horrible, right? I mean, that would be like beyond horrible. But, you know, as you work through your interventions and you get to your results section, which is data analytics number 4, then you could say, because we did this intervention with a timer that went off and said, oh, your time's up on your antibiotic, you have to rerun it, or whatever your technological or information systems interventions were, then your results would be, we reduced our rate from 90% of a surgical site infection rate to 50% within a year. And, you know, the departments that did the best with this were ortho and something else. I mean, because GI obviously is a really hard one. You know, but GI improved their infection rate by only 20%, but still, you know, it's improving. So just to give you like food for thought on how these all tie together, and how these papers are going to kind of interact and how you can kind of tweak them a little bit as we go along. And I know that these videos get a little bit long, but I really, really love to give feedback so that we can improve. And then your references page, these would all be double spaced. So you would set your spacing to double space. And then this here would be tabbed over 5. So I'm not sure if you had to hit enter and then backspace it, because I know that sometimes spacing is a little crazy. But if you come to this where you see this little caret here, that's your first one. And then if you drag this little triangle left indent and you pull this over, it will help you line these up. And then when you hit backspace here, the next one automatically lines it up. So I suspect, again, that you probably had to like hit enter and tab these over. Which is fine, but I'm just kind of showing you an easier way to do it. And then your references page, you always want to be in alphabetical order. So I'm going to bring this one up here. And there you go. So it should look just like this. And then if this is the actual name of a hospital, you would want to keep those capitals. It's just when there's not a proper noun that you wouldn't need to. So it would be Southwest Ethiopia. So if it's a proper noun, it should say a proper noun capitalized, but the other ones you can see are lowercase. And then the rest of that looks good. This one looks good here. And then again, the last one would be in alphabetical order. And the only other thing I would just mention is to watch your font types, because you can see that this is different than the previous one. And then, of course, this one is going to just be a little tricky here. So, I don't know why it's changing. But either way, this would just be in Times New Roman, just like the rest of it. And that way you have all of the same font. And that's magical. It fixed the font as soon as we corrected it. So that's awesome. So, again, I know it's a little long, but I just like to really help you get these improvements made. So if you have any questions, please reach out. That's what I'm here for. And then, of course, references would be on its own page at the top. So thank you for your submission, and I look forward to working with you on your third paper.